Linezolid, also known as Zyvox Solution, Intravenous, is an antibiotic used to treat certain serious bacterial infections. It works by stopping the growth of bacteria. It also belongs to a class of drugs known as MAO inhibitors, which can increase the levels of certain natural substances in the body. This can increase the chance of certain side effects and food and drug interactions. Be sure to consult with your healthcare provider for more details on how to use this medication, its side effects, and potential drug interactions. When using Zyvox Solution, Intravenous, it is important to follow your doctor's instructions for dosage and frequency of injections. It is typically given every 12 hours, and should be injected slowly over 30 minutes to 2 hours. The dosage will be determined based on your medical condition, response to treatment, and for children, their age and weight. Your healthcare professional will provide you with instructions on how to prepare and use the medication at home. It is crucial to follow a special diet to limit your intake of tyramine while using this medication, in order to prevent a serious high blood pressure reaction. This includes avoiding certain foods and beverages such as aged cheeses, dried/aged meats, preserved fish, products with large amounts of yeast, fermented foods, soybean products, certain beans, and certain alcoholic beverages. Consult your doctor or dietitian for a complete list of foods to avoid. To ensure the best results, use this antibiotic at the same times every day. It is important to continue using the medication for the full prescribed treatment period, even if symptoms improve before the treatment is finished. Be sure to inform your doctor if your condition persists or worsens. If you experience diarrhea, headache, nausea, vomiting, or dizziness, it's important to inform your doctor or pharmacist. Keep in mind that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. While many people using this medication do not experience serious side effects, it's important to seek medical attention if you experience deep/fast breathing, unusual drowsiness, persistent nausea/vomiting, numbness/tingling in the hands/feet, unusual tiredness, easy bruising/bleeding, muscle stiffness, increased sweating, vision changes, mental/mood changes, or seizures. Additionally, contact your doctor if you develop severe diarrhea, abdominal or stomach pain/cramping, blood/mucus in your stool, white patches in your mouth, changes in vaginal discharge, or symptoms of high blood pressure. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, or trouble breathing, seek medical help right away. If you experience any other effects not listed, be sure to contact your doctor or pharmacist. Before starting Zyvox Solution, Intravenous, make sure to inform your doctor or pharmacist about any allergies you may have or if you are allergic to any of the inactive ingredients in this product. It's important to also discuss your medical history, especially if you have high blood pressure, blood or bone marrow problems, kidney or liver problems, certain tumor conditions, an overactive thyroid, or a history of seizures. Be cautious when taking this medication as it may cause dizziness, especially when combined with alcohol or marijuana. Avoid driving, operating machinery, or performing tasks that require alertness until you know how this medication affects you. If you have diabetes, Zyvox Solution may lower your blood sugar, so it's important to monitor your blood sugar levels regularly and discuss any changes with your doctor. It's also important to inform your healthcare professional if you are using Zyvox Solution, Intravenous before receiving any live bacterial vaccines, such as the typhoid vaccine, as they may not work effectively. Additionally, if you are planning to undergo surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or breastfeeding, discuss the risks and benefits of using Zyvox Solution with your doctor to determine if it is necessary to continue taking this medication. Now let's talk about some important things to keep in mind when using Zyvox Solution, Intravenous. First, it's crucial to be aware of any potential interactions with other drugs. Make sure to inform your doctor about all the medications, including prescription, non-prescription, and herbal products that you are currently using. This will help to avoid any potential risks and ensure that the medication works effectively. Some products that may interact with Zyvox Solution, Intravenous include diet pills, drugs for attention deficit disorder, certain pain relievers, supplements, and certain antidepressants. It's important to be cautious when using this medication alongside other drugs that increase serotonin levels, such as certain antidepressants, street drugs, and certain migraine headache treatments. It's also important to note that some products can interact with Zyvox Solution, Intravenous if used together or even weeks before or after using Zyvox. It's crucial to inform your doctor or pharmacist if you have used any of these products within 2 weeks before or after using Zyvox. Additionally, be sure to disclose if you have taken fluoxetine within 5 weeks before starting Zyvox. Your doctor can provide guidance on how much time to wait between starting or stopping any of these drugs and starting Zyvox. Furthermore, it's important to avoid taking other MAO inhibitors with Zyvox Solution, Intravenous, as this may lead to serious and potentially fatal drug interactions. Most MAO inhibitors should not be taken for 2 weeks before and after treatment with Zyvox. Talk to your doctor for specific instructions on when to start or stop using this medication. Lastly, it's crucial to report the use of any drugs that may increase the risk of extremely high blood pressure when combined with Zyvox, including herbal products, allergy and cold products, and stimulants. These medications should not be used with Zyvox Solution, Intravenous. Be sure to consult with your doctor or pharmacist for more details on how to use this medication safely. If someone has taken too much Zyvox Solution, Intravenous, and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to note that while taking Zyvox Solution, Intravenous, you may be required to undergo lab and/or medical tests, such as complete blood count and blood sodium levels. Additionally, if you are taking this medication for 3 months or more, or if you experience any changes in your vision, it is recommended to have regular eye tests. Make sure to keep all medical and lab appointments as advised by your healthcare provider. Make sure to take each dose of Zyvox Solution, Intravenous as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing Zyvox Solution, Intravenous, make sure to keep it at room temperature and protect it from light and freezing. Keep the infusion bags in the foil outer wrap until you are ready to use them. It's important to keep all medications away from children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you are unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.